Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down as best I can into simple terms. And at times, as you know, I have a guest with me. So today we're moving forward with our podcast. And as you know as well, I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today I have a wonderful guest with us by the name of Brittany Simon. I want you guys to all welcome Brittany. Hi, Brittany. How are you?
Hi, I'm so happy to be here.
Thanks for coming.
Of course.
So the podcast for me is new, as you kind of know. So you're one of my first guests. Thank you.
I'm honored to be here.
Thank you. And today, what we really want to kind of go into, I always ask everyone first to kind of give us a little background introduction to who you are, what you do, and why you being on a podcast about pregnancy makes sense to us.
Yeah. So I, as you said, I am Brittany Simon. I met you through our significant others.
Mm-hmm.
We met, and I recently had a daughter, Sloan. So she is 4 months old now, which is wild. It's been the longest and shortest 4 months of my life.
And she's adorable too.
She is
absolutely
very
adorable.
Sweet. And I was connected with you right in the beginning of my pregnancy, which was a godsend because I didn't know something like this existed. And it was so incredibly helpful and beneficial to me.
Okay, this is your first pregnancy,
yes.
Right? Or was your first pregnancy,
yes. So
right?
This was my first pregnancy, and I had been on birth control since I was 18 years old, and I wasn't sure how long it would take. I'm 34, so I'm right at the cusp of being a geriatric pregnancy. And so my husband and I started trying in January, and we were lucky enough that I became pregnant in March. Yeah. And from there, it was, it opens Pandora's box of like, okay, what now? And where do I go? And the internet can be a very scary place full of misinformation. So being connected with you was incredibly helpful to help guide me through my pregnancy journey.
So I went for the listeners and anyone watching too, when we got connected, what I do now, thankfully, is becoming more formal and hopefully getting out to more and more individuals. But when we kind of started, this was Brittany, I think, needed someone to maybe just answer some questions and be, like she said, since the internet can be so confusing and a lot of misinformation and data coming at you from all different aspects, like what information is legit and how do we kind of formulate a plan for asking the questions to your provider and whatnot. So we learned from each other because for me, it was really helpful. Like, I think providers sometimes assume that patients know certain terms.
Exactly.
Right?
And I think when you are a quote unquote low risk pregnancy, I think the volume at doctors' offices is, overwhelming. And so they are trying to get you in and out as quickly as possible.
Yeah.
And as a first-time pregnancy, I had lots and lots of questions. Yeah. And so having someone to debrief with after the fact really was, informational to me because I would leave those appointments being like, wait, well, what does that mean? Or, I didn't want to look stupid in the appointment and ask like, wait, can you explain this? Or they didn't have the time and they were rushing to their next patient.
Yeah. And it is a sad thing, I think, as a provider to know when you look at your schedule in the morning, like, oh my gosh, there's 30 patients, there's 60 patients. How am I going to give my time to them all? But on the flip side, like if I'm the patient, I'm like, that's not my problem, right?
Exactly.
I mean, not to be rude, but it's not.
No, and to me, it's like, well, wait, no, this is my first pregnancy. Right. But to them, you're just another patient
you're low
that
risk.
day.
Yeah.
I'm low risk. There's nothing to worry about. Yeah. But you still have questions and you want to get answers from the doctor versus the internet or, seeking out friends. You want a professional opinion.
Yeah. So that actually brings me into the point of like, what I'm trying to do, right, is like, if you have questions and you want that one-on-one consult, even if you're not quote unquote high risk, and we have like these discussions with other people on the podcast and on the website as to what makes people high risk, and it can be so different. But just because you have a pregnancy doesn't mean you have no risk.
Of course.
And so like to be able to have someone to ask those questions, and not just someone, but someone who's board certified in OBGYN and maternal fetal medicine to answer those questions on a professional level, and then that second tier of having time with me that's dedicated to you and you leaving with questions to ask your provider.
Exactly. And that was also really helpful during our time together was being armed with information before I even went to the doctor's office. I felt like there were a few appointments I had where my doctor looked at me like, wow, how did you even know to ask that?
Right.
But it was because of our time together and because of all the information that you had provided based on which appointment it was and based on which week it was of my pregnancy.
Yeah. And I think I'm glad that helped, because being the provider, I sometimes see people after they've seen their OB provider, and I'm like, wow, I feel like there's a few things that were missed. Like, how can I make that, like, bridge that gap a little bit more?
Yeah.
So this is me trying, right?
Yes.
So we'll see. We'll see. So you mentioned questions, and as anyone listening or watching knows, I always try to ask the same questions to everyone just to see. So remember Brittany just had a baby 4 months ago.
Yes.
So she is fresh out of having gone through a pregnancy. So we always try to think about, for people who are currently pregnant or people who had babies 8 years ago, or you just had a baby, like, I wonder if some of these terms and questions are going to resonate.
Yeah.
Okay. Are you ready?
Okay, I'm ready.
Okay. All right. Question number 1. What does the abbreviation OBGYN stand for?
Obstetrician gynecological. Oh, okay. That's it. That's all I've got.
That's pretty good. That's pretty good, actually. Obstetrician and gynecologist, or obstetrics and gynecology.
Okay, so I was close. Okay.
Yeah, that's good. That's perfect. That's perfect.
I don't know if each letter corresponded to something. Okay,
right?
I feel better about myself now.
So many abbreviations in the world of OB, and we don't even. You never hear someone say, "Who's your obstetrician?"
No,
right? No one says that.
No,
and it's an obstetrician and gynecologist together, but one does the OB, which is the pregnancy, and then
one does everything else.
But they're an OBGYN all in one, so they do both most of the time. However, this brings me to the point of, like, it's always good to ask your OBGYN, hey, how much OB do you do versus GYN?
That's a really good question, one that I didn't even ask.
Yeah, because, some of them do half and half, some do mainly one or the other. It's very interesting. Yeah, It's the changing world with that stuff. Question number 2, what do the letters MFM stand for?
Maternal fetal monitoring?
Oh, so close.
Oh,
maternal fetal medicine.
Dang it.
I know.
Okay,
that's
close.
Okay. That's what I do. And I don't want to say my family. I think my family gets the abbreviation now, but no one knows what it is. Like, if, when you go somewhere and you're just meeting people, like, oh, what do you do? And they're like, oh, I'm in real estate, or I'm in marketing, or I'm a teacher. Like, it's a very clear, and people are like, yeah, I know what that is.
Yeah.
So for me, I'm like, maternal fetal medicine specialist. They're like, I don't know what that is.
Yeah. What is?
Then I say perinatologist, which is another term to say. And they're like, oh, paleontologist? That'd be so cool, but no.
But no.
And then I usually end up with saying I'm a high-risk OB doctor or obstetrician. I had to say OB because obstetrician...
Again, it doesn't land with people.
Exactly. So it's very, very interesting. And sometimes I just say I'm in healthcare. Yeah. Just leave it at that.
And keep it moving.
Keep it moving, yeah. Okay, question number 3. How does a provider come up with your due date when you're pregnant?
Based on your last period preconception, right?
Yes. Great. This is one I love because there is a YouTube dedicated just to this on my site.
Oh, that's wonderful.
And I think it's called, like, what is my due date? And it literally goes through, like, step 1, tell your doctor your last menstrual period. Step 2, they should do an ultrasound.
Yes.
To confirm if your last menstrual period is truly the thing to use for your due date. And then step 3 is, do you change it or keep it, right? And it depends on how far along you are if you change it or keep it for the due date.
Well, and I think ours was within 3 days, so they kept it.
See, and you even at least know that terminology of it was within 3 days.
Yeah.
And so if you were to see a specialist during the pregnancy and they say, what's your due date? You would know, right? Because you communicated that. So many people get so far along in their pregnancy and they're like, I don't really know. They've told me 3 different dates, right? And that happens with people because the ultrasounds happen and those can be confusing as well. So anyway, so fun. So many things. So many things.
Yes.
All right, question number 4. When is a pregnancy considered term?
Okay, I think, so I thought it was 37 weeks, but it is in fact 38 weeks? 39 weeks?
37. Still 37.
37, okay.
Yes. And so on your due date, you're 40 weeks pregnant.
Yes.
Right? So that's when your due date is. That's when you're 40 weeks and 0 days by the calculations of the wheel and the things that we use, right? 37 weeks and 0 days. So spot on at 37 is considered your term. They have changed these terms, right? The terminology. 37 to 38 is like early term.
Yes.
So even within the wording and the terminology of term, there's 4 different categories now.
Yeah. And when I was pregnant, you download all of these apps to track your pregnancy. And I remember when I reached that point, they each said something different. Like some would say 37, you're full term. And then others would say, oh, it's still early term. And so I think, there's so much confusion even within that jargon.
Yeah. Oh, for sure. For sure. This is where it's like, somebody the other day said to like, check your source. Like, who's your source? So if you find any data on now it's the internet, right? Or if you read a book or whatever, it's like, well, what was your source? Right? So like when I read that Kim Kardashian did something amazing and I tell my friends, they're like, they just take it as truth.
Yeah.
But it's like, well, where did you see that, hear that, read it?
Exactly.
Right? And so that's very true. Like who is your source? What is your source? All right, question number 5. What is a normal fetal heart rate?
Okay. There's a range.
There's a range. There you go.
I feel like 120 to 160.
Oh my God, so good. Technical answer is 110 to 160, but we do, but 120 to 160 is an appropriate answer.
Great.
Very good.
See?
Oh my gosh. This is great.
Working with you.
This is great. I love this.
I know all of this.
You do, which is fantastic. This is great. Yeah. Okay. Question number 6. What is antenatal testing or fetal well-being testing?
Okay. Well, you lost me there.
Okay.
I was doing too well.
You were doing too well.
Antenatal testing.
And because she and I worked together somewhere before, remember how we talked about when you get to the end of the pregnancy, if they deem that you're high risk for any reason, they might do some type of testing?
Yes.
That's what it is.
Okay.
Yeah. So it's just like if someone's high risk, they might need this type of testing.
So would that be extra ultrasound, stress tests, things of that nature?
Stress test. See, you know that term.
Okay.
That, exactly. So, and then they call it an NST, a non-stress test, because it's supposed to stress test. But, we can't just say a term. We have to squish it down into little letters.
A little abbreviation.
All the time. All the time. Okay, this is one of my favorite questions. Okay. Question number 7. How does an ultrasound estimate the weight of a fetus? I think you know this one. So like when you had your ultrasound when you were 30-something weeks and they told you how much the baby weighed. And there were all those numbers on that piece of paper that were so confusing. Do you remember any of those or what they were?
I do. And I remember we went over it. Was it based on percentages and measurements? And is that how we put it all together? Okay.
Yes. They measure around the head, side to side of the head, the arm bone, the leg bone, around the belly. And then there's all these numbers and percents. And then, exactly.
Okay.
So, fantastic. All right, this one's fun too. Question number 8. What is it that makes up amniotic fluid?
I don't know.
It's a good answer. It's pee. It's the baby's pee. It actually, the fluid around the baby peaks at around 30, 31 weeks. Then it starts to go down a little bit. So when people are like, my fluid is or is not normal, the question too is, what's your gestational age? Like, how far along are you? And if it's high right at that 30-week mark, that's not a bad thing. And I say high normal, right? Not too high. But if it keeps going up, 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 the further along you get, that's not standard. It usually starts to plateau and then start to decrease a little bit. Yeah. So when people kind of have that anatomy ultrasound around the 20-week mark, and then maybe at 30 weeks, you have a growth, right?
Yeah.
And the fluid's pretty substantial. If you were to go in the day before your delivery and they checked the fluid, and maybe you were 40 weeks along, right? And the fluid's lower. I've had patients who are like, oh my gosh, that's so different than what it was at 30 weeks. That's okay. That's normal.
Okay.
That's a normal thing to see.
It's trending in the right direction.
It's trending in the right direction. Same with heart rate too. It starts really high. Like it even can start in the 170s when they're teeny tiny little peanuts. And then as they get older in the womb and the gestational age increases, their heart rate will trend down a little bit.
Yeah.
Still stays within that, 110 to 160 range, but that also makes parents nervous because if you see a heart rate in the 160s and 150s for a long time and then you're 40 weeks and you're like, oh my gosh, it's in the 120s. That's so different and low. It can still be the normal trend.
Well, and during some of my appointments, I was able to experience some leaps. So, between 36 and 40 weeks, when they would check her heart rate, we would be there and it would be 130 and it would jump up to 170. And they said that was actually good because it was a leap and it shows that she's moving and growing and all of that.
Yes, absolutely. We call them accelerations, right? The heart rate jumps up, which is awesome. Like we know that that's good fetal well-being.
Which is scary as a first-time parent. You're in there, you're like, wait, why is her heart rate so high? What do we need to do? But then
it's good. Yeah. Did you ever experience feeling any hiccups?
Yes.
Tell me how that felt.
It was the most surreal feeling. I remember it was last summer. We were in Colorado and all of a sudden I was laying in bed and I wasn't sure if it was her heartbeat or what was going on. And it was, I could feel these little, I'm trying to, how do I describe it? Little like blips in my belly. And it was different than her moving around.
Yeah. Did it feel super fast? Like a, I don't know how to ask way to describe it.
It was consistent. Just fast little like quick, rapid blips where I would go, oh, something is happening.
How long did it last? Do you remember? Was it like short-lived or was it like...
a couple of minutes.
Okay.
Yeah.
It's actually very reassuring when they hiccup. I've had patients who are concerned that their baby is having a seizure because the movements they say are so fast and different than just like a roll or a kick that they have this nervousness and they Google it, right? And they're like, the internet told me my baby is having seizures.
Yeah.
And I just want people to know out there that fetuses do not have seizures.
Yes.
A pregnant individual can have a seizure, but the fetus in the womb cannot. And the hiccups are good signs of well-being, which is great.
Well, and I think, this is jumping a little bit, but something that was so helpful that you guided me on was asking where my placenta was located. And that was something I wouldn't have known to ask.
Yeah.
And they didn't provide the information to me until I asked. And then I found out it was at the front. And so that's why when I wasn't feeling as much movement, when I would talk to friends who were pregnant and they were like, oh, he or she is kicking up a storm, I'm feeling so much. I was paranoid and in my head, like, is it normal that I'm not feeling as much movement?
Yeah.
But then knowing that the placenta was there and so that's completely normal was really reassuring to me.
Yeah, for sure. And I, it's one of those things too, when a placenta's on the front, the movements you feel or someone with a placenta that's on the front side can be different. Because if you don't have that placenta there and you don't have a lot of adipose tissue or fat tissue on the front, you can sometimes, you've seen the videos where you can see the baby moving. If you have an extra layer of a placenta up there, anticipate that you won't, part of the movement too is you can almost see your belly move. And so you might not have that as much, especially earlier in the gestation, right? So babies usually start to move around 20 weeks, 20 to 22 weeks. You generally tell people. And we call it quickening. That's what they call it, quickening. And when people are like 16 weeks and like, I don't feel the baby move, that is a normal thing.
Yes.
But if that's ever a concern of yours, you can talk to your doctor and they can do an ultrasound and you can see the baby and see the movements. And also have some reassurance on, is there a miscarriage that happened and I just don't know it because it's so early that I don't feel movements? How would I know, right? Yeah. So always, if you feel like something's ever different, talk to your doctor. I always tell people that because nobody can feel the baby or not feel the baby like you can.
And no one knows your own body better than yourself.
Exactly. All right. This one I know you're going to know the answer to, I believe. Question number 9. Who should be offered Down syndrome screening in a pregnancy?
Everyone.
Yes.
Everyone.
I feel like you are just so well prepared for all this. This is great. And she had no idea.
Teacher.
Thank you. All right. This is our last of the questions here. Question number 10. What is considered a normal length of a cervix during pregnancy?
I don't know, but I do remember you told me that mine was a little bit short.
I remember we did discuss that.
So we did discuss this, but I don't know what is a normal cervix.
I almost feel like this is one of those, not a trick question, but because someone brought this up the other day, they're like, well, at what time during the pregnancy? I'm like, touche. The only time really when you are a low risk, I'm air quoting here, low risk pregnancy, that you should have your cervix screened is sometime around the 18 to 22 week mark. So usually around 20 weeks.
Okay.
And they can do it with an abdominal ultrasound or sometimes they put a vaginal probe into the vagina. We call it a transvaginal ultrasound or endovaginal ultrasound, some people call it. And they look at the length of the cervix and we want it to be above 2.5 centimeters. We love for it to be above 3 centimeters. So if it's below 2.5, people call it short. If it's above 3, we're like normal. If it's between 2.5 and 3, sometimes it's like just curiosity. I think you were there,
I think I must have been in that, like, I feel like I was like 2 point something.
2 point something. And so it's one of those things too, it opens up a whole can of worms on questions because for people that are doing that screening, they really need to be trained in how to do that ultrasound because you're meant to do it multiple times because the cervix can be dynamic. I always tell people like an accordion in a way. So it can look one length and then it can move a little bit. So you're supposed to watch it, take multiple pictures, possibly put a little bit of pressure to see if when you place pressure, there's a change in it. Yeah. So it's not just a one and done quick camera look. It's not meant to be. It's meant to be, looking a few times. So a lot of little things to discuss about that, right? I love that. All right. So now we have 10 quick, these are true, false questions.
Oh boy.
Then we're done with the questions, I promise.
All right.
All right. True or false? A fetus can have hair in the womb.
True. I witnessed that firsthand. Very true.
Could you see it on the ultrasound?
We could see it on the ultrasound towards the end. And then I saw it.
I love it.
Yeah.
Was she born with like a lot of hair?
She was born with a full head of dark hair. Yes.
Was it straight?
It was straight.
Curly?
Yes.
Yeah.
And the old wives' tale that you have acid reflux if your baby has hair is not true because I did not have bad acid reflux.
There you go.
And she still had a full head of hair.
That's another thing we've got to try to get into today, any myths that you heard, because I would love to hear myths, because I feel like some people just take that as true and then they run with it, and it's fascinating to me. All right, true or false? Question number 2, a fetus can hear.
True.
True. Very good. Starting around 25 weeks, they have acoustic, they can feel vibrations and this is like hear the stuff. That's why when people say, I had somebody one time that said, my baby loves Metallica. And I was like, what? She goes, when I don't feel and move as much, I'll put the headphones on my belly. It's the vibrations. They can,
That makes sense because we would play classical music for Sloan and she didn't move as much because there wasn't as much.
Not as much bass.
Yes.
You needed something a little more like
Metallica
for pregnancy.
Okay.
There you go. Question number 3, true or false? If a pregnant individual eats sugar, this will wake a fetus up if they're sleepy.
True-ish.
This one's interesting. I had another maternal fetal medicine doctor on the other day talking about this, but the answer I would say is false. It usually can make babies a little sleepier. So there's nothing really that you can wake a baby up with. You can try the acoustic, vibrations or something on the belly. We do say like cold water or stuff, but drinking a sugary drink is not going to really
wake the baby
do
up.
it. Yeah. Plus it just can make, people say you get like
those spikes. Yeah. I mean, babies just like humans.
Yeah, exactly.
If I have a lot of sugar, I need a nap. So I understand.
Right? But it doesn't keep me away from chocolate. I gotta say that though. I just can't. All right. True or false? Question number 4. Everyone should be screened for diabetes when pregnant.
True.
Very, very true. And how did your diabetes screening go?
It was great. I think people had psyched me out over the glucose test and the drink and horror stories. And, to be honest, I didn't think it tasted that bad.
What I've had people tell me kind of what it tastes like, but tell us, what did it taste like? If you had to just compare it to something, was it sweet? Was it salty?
Oh, very sweet. Like a sugary, like a Hawaiian punch almost,
That's fine.
Just a really
and it's like a shot,
drink.
right? It's
real quick. It's real quick.
Real quick. Okay. So for people listening to and watching the glucola test, we call it a glucose challenge test sometimes, or a glucose tolerance test. You chug this thing of a lot of sugar all at one time, and then they test your blood levels an hour later and see how much your internal glucose level goes up. People just say terrible things about this test. And if you have a doc who's trying to do like the jelly bean test or something else, the problem with those is that they're not able to really say it's this certain exact amount of glucose that you're drinking. So you're not really able to compare it as well. But if you're someone who's like, I had a terrible experience, I'm not going to do it. My recommendation to talk to your provider about would be like, hey, just give me a glucometer, like a machine at home, and I'll prick my finger for a week or two, and you can tell me if I have elevated levels, because then you don't have to drink anything or ingest
And I've heard a lot of people who don't want to do the glucola, they don't want to do the drink, and then they find an alternative with their provider.
Exactly. So talk to your doc in case you don't want to do that. But definitely get screened somehow, right? Yes. Everybody should be screened. So next question, true or false? Everyone should be screened for thyroid disorder when pregnant.
I wasn't, so I'm going to say false.
It's false.
Great.
Correct. The thyroid naturally changes in pregnancy anywho. So if you have symptoms, be screened for symptoms, right? That they're doing a screening test because of, or they're doing a test because of a symptom. But for just universal screening, the answer is no. It's false. Great. Good job. All right. You're like killing this, man.
Star student.
All right. All right. Question number 6, true or false? Someone with 2 prior cesareans has to have another C-section.
False. That is what a VBAC is.
Correct.
Vaginal birth after cesarean.
See, all the abbreviations.
All the abbreviations.
And we even use TOLAC, trial of labor after cesarean. And then once you deliver vaginally, then you've had, past tense, a VBAC.
Wow, I didn't know that one.
Right? So confusing. It used to just be you needed to, if you had one prior, you could do the trial of labor. Now, if you've had 2 priors, you have the option to discuss a trial of labor. And there are calculators online, if you guys are listening, that you can go, it's called like a VBAC calculator or TOLAC calculator or something, but you can just Google TOLAC or VBAC calculator, and you put in why you had the prior C-sections. And it actually will tell you roughly your % of success of trying to have a vaginal birth. Isn't that great?
That's great.
So
what a
like,
great tool.
I know. And I can't do that. I don't do math in my head. If any of my patients are listening, they know that when I say your follow-up is in X weeks, I'm like, 1, 2, 3, 37 weeks. Right? Exactly. And actually, I have a friend that's a math teacher and tutor. And when I say carry the 1, she goes, we don't carry anymore and we don't borrow. Because if you borrow, you give something back. What? That's how math is now. I know. I was like, no, I'm still going to carry my 1.
Yeah, I'm always
and
carrying
I'm still going to borrow from,
exactly.
That's how I do it. That's for January de los Santos, if she's listening too. She's trying to teach me math as a 40-something-year-old woman, and it's not going well. It's too late. So with that, though, I always, when I was in the clinic, or if I have a patient, and if I had a patient now that I was just had a consult with me and one-on-one, and she's like, hey, this is one of the things I'm curious about. I would, on the computer with them, pull up the calculator, share my screen and say, hey, let's look at this and see if we can calculate what your success rate would be.
Yeah.
Because then the important thing too is some hospitals don't have the resources to offer individuals a trial of labor.
Yes.
And if you know that early and you're like, I really would like to try, I understand it's not going to be a success rate of 100%, but I'd like to try, then you can find a provider and a hospital that allows it.
And that's something I learned during my pregnancy is not all hospitals are created equal.
No. And I think people don't think about the hospital for delivery, so people don't think about the hospital during a pregnancy until they're almost ready to deliver.
Exactly. And then you don't even realize what they offer and what they don't offer. And, to some people, and depending on what your goal is for your birth, it might be very critical. Like to me, it was just, everyone delivers at X hospital. So that's where I was delivering.
Yeah. Yeah. Always a beautiful question to ask too. And that segue, before we finish the questions too, there is a sheet, and Brittany has it in front of her. It's the advocacy sheet that's online. And it just goes through kind of for anybody like Brittany was saying, who's low risk, that thankfully, hey, everything's going great with the pregnancy, but I still need to know the right questions to ask. And that's kind of one of the questions too, like, when am I delivering and where am I delivering and how?
Yeah.
It could change, but can we talk about it before it happens? And you can find those sheets, drlexihill.com/advocate. Okay, so question number 7. Twins that are the same gender are always identical.
False.
So correct. Oh my gosh, you're crushing this. All right, question number 8. No cheese is safe to eat while pregnant.
False.
False. I think we went through this.
I think we did because, yes, I definitely indulged in some cheeses. So I made sure to run it by you what was safe and what was not safe.
Yes. And I think that's the other thing too that I love about being able to do consultations with people that, again, I'm going to air quote this, low risk, doesn't mean you don't have questions and risks in a pregnancy. And that was a thing that you taught me of like information I can share with people that I didn't even think they didn't know, or I didn't even think that they would have a question about it. So I think that was great. And
that's one of those ones that there is a lot of false information out there, or you are hyper scared. And so your gut instinct is to stay away from everything. When in fact, you should live your life and eat some cheese while you're pregnant.
There you go. There you go. Pasteurized cheeses, people. Pasteurized. It sounds good when we say pasteurized on the mics. Pasteurized. I like it. Okay, question number 9. True or false? Someone trying to get pregnant should start taking folic acid before their pregnancy.
True.
And do you know why? I think you know why.
Because you want to build up,
I'm taking her to a new level, guys, because she's gotten every question right. And I'm like, man, like stump the professor, but I can't stump her. Does it prevent something?
Yes.
Yes, it can. And it prevents neural tube defects like spina bifida.
I knew it. And
I think I looked this up last night because I had a guest on recently too, and we were talking about birth control pills, right? And I know that they have added, and before I did maternal fetal medicine, when I was in medical school in Texas, I had a mentor by the name of Patsy Shulak. And it doesn't have an H in it, but it's pronounced Shulak from what I recall. She was fantastic. she did great research on birth control pills. And I just got all into this research and excited about women's health. And one of the things that we looked at was the cycles of birth control pills. You know how usually it's like 21 pills that you take and then 7 are your sugar pills?
Yeah.
Then they switched to some 24-4. So you take 24 active pills and then 4 sugar pills. The whole point is you don't want, when you're on birth control, you're trying not to ovulate.
Yeah.
And so the longer of a break you had, the higher the chance you had of this ovulation occurring, right? And if you're trying not to get pregnant, that's part of the thing. So not to get too much into birth control pills, but some of the more recent birth control pills are adding iron into the pill so that if you do get pregnant, that you have iron on board, because every pregnant individual should take a low-dose iron pill as well. Second thing, and I actually I looked this up on the internet last night. Like I'm in bed and it was in my brain. I'm like, I've got to know, because I said a statement that I thought I knew was true. And I was like, maybe I wasn't right. I was right. Thank goodness. They do have pills now, birth control pills, that have folic acid in them.
That's wonderful.
So that if you get pregnant, or if you get pregnant while on the pill, or say you stop taking the pill and you get pregnant immediately, you've been getting that folic acid. Because you're supposed to have it for about 3 months before conception and then continue it through the first trimester, right? So I thought that was fascinating.
That is fascinating.
And like most people on birth control are not taking a prenatal vitamin.
No, because you think, oh, that's counterintuitive. But I think that was something that we did a real deep dive on too, because I think there are so many prenatal vitamins on the market. Yes. And again, not all prenatals are created equal. And when you really do a deep dive into the ingredients and what's in them, there are a lot that have filler and things you don't need, or things that aren't helpful or beneficial to you. And so I remember we went back and forth on finding one that had everything, or almost as close to everything that I would need.
Right.
And I'm still on it 4 months postpartum.
Yeah. And it's very, I continue to do research on this to try to find the best prenatal vitamin. And I've seen some recently too that go, one is prior to becoming pregnant, one is first trimester, second, third, and then postpartum, which now some people are labeling the 4th trimester.
Yes.
Right. And I think it's great. And actually they're not, some of those that are trimester specific aren't just one tablet, they add a little extra here and there. And in all honesty, the folic acid is most important for the first trimester. So if you're taking the same prenatal vitamin the whole time, you might be taking levels of folic acid that you don't need later. And if it's extra, some people get nauseous with that, et cetera, et cetera. So I have a separate YouTube on prenatal vitamins. And I tell you, when I was doing research for that, you can see me at Whole Foods and all these stores. Like I'm that person who's there for like 30 minutes reading the labels.
Magnifying glass out.
Because they're so small.
They're so small.
And I'm kind of like doing this, like moving it toward my face, away from my face. And some of them, I can't believe some of them didn't have iron in them. Like how is that even, or folic acid? Some of them, that's like basic stuff. So anyway, if you're listening to this too, you can also go to like the American College of OBGYN, which is ACOG, which has tons of patient information, frequently asked questions, and you can actually see what's recommended in the exact amounts to be in a prenatal vitamin. And that's what I went to. And then when she and I had like a visit one time, which we did on not technically Zoom, I'm not going to say Zoom, but we used Google actually. We used like a Google shared Google Meet. And then we can share our screens and we can talk about things. She had an Excel file that was specifically hers that we could update, and we could share pictures. We went through like, hey, when you have your nuchal translucency, this is what it's kind of going to look like. If you have a question, ask. Here are the questions to ask, So
this is what's normal. This is what's not normal. This is what you should be on the lookout for.
So it was really fun to go through all that too. And also to learn how hard it is to find a prenatal vitamin. Fascinating to me.
For how many there are.
Right, exactly.
There's
so
a lot
many.
Yes.
So many. All right, I'll give you the last question here. I think this is the last one. Question number 10, true or false? Baby aspirin is an over-the-counter medicine that can prevent a certain type of high blood pressure during pregnancy.
True.
Very true. Yes. What does it prevent? Do you remember that high blood pressure term?
I don't.
Preeclampsia.
Preeclampsia.
Do you feel like you see that in the news a lot? Like when you were pregnant, were you vigilant on looking at like, I don't know, like did your phone like know you were pregnant so the news all of a sudden
what I
is
was
like,
served. And I think when I was pregnant, there was actually a big New York Magazine article, or there was a big article that had come out about the rise of preeclampsia. And it was really scary. And then I had quite a few friends, or, a surprising amount of folks that were affected by preeclampsia or early term labor. And so it was something that I was hyper aware of.
Yeah.
And especially having had COVID at one point, I started taking baby aspirin immediately. And that was something that I had talked to you about as well.
And you had COVID during your pregnancy,
Yes,
right? Was it the first time that you got COVID?
It was the second time.
Because it's such a weird world now, right? Like, it's not like if you got COVID, usually it's like when. And then first, second, third time.
Yeah, like exactly. Yeah.
Did you find, because you were in the era, because I was around during the COVID stuff. I mean, clearly I was around, but whenever it was pregnant individuals and obviously people, but my field is pregnancy, when there was no vaccine.
Yeah.
And then there was. So where did you fall into what was going on in the world of recommendations, and how did you feel like you navigated that with your providers?
Yeah. So I think it was an interesting time because it wasn't at the height of COVID. It was post-vaccine. And I think in one of my first appointments, they asked if I had received the vaccine and any boosters. And so they were up to that. They wanted to make sure I was up to date on that. And then I think in my last trimester, they wanted to make sure that I had my flu vaccine. And with COVID, it was interesting. They didn't mandate it. It was just more of a suggestion.
Yeah.
But since I had already had it during my pregnancy, they said I didn't need it.
A
booster.
COVID, the booster.
Another booster. Yeah.
Okay. And then you mentioned the flu vaccine too. Did you get the flu vaccine?
Yeah. So my husband and I both got it in my third trimester.
Okay. And then I think the other one that you might be talking about is that thing called Tdap. Do you remember that?
Yes.
My Tdap that I got years and years ago hurt.
Oh yeah.
Did yours? Was it pretty sore?
It was a little painful. Yeah, a little tender.
And so this is there's emails that come through almost on a daily basis for physicians that are registered with certain like journals. And so it's interesting the stuff that's coming out. And one I got this last week was Tdap, which is for tetanus, diphtheria, pertussis is what that kind of stands for. It was like, oh, Tdap is recommended in pregnancy. And I'm like, it's been recommended in pregnancy.
Well, I think it's so funny because I think in this, post-COVID world, there is more of a sensitivity to different vaccines and things that you should and shouldn't do while pregnant.
Right.
And to me, Tdap was a no-brainer.
Yeah.
We've all been getting Tdap forever.
Yeah.
And I didn't realize that it could even be controversial.
Yeah.
Or that people would question it because we were, we had our daughter in November around the holidays, a lot of people around, and my Tdap shot would, help my daughter, give her some immunity until she could get her shots at 2 months. But we asked people that were going to be in close contact to make sure they were up to date on Tdap.
Correct. Yeah.
And we were surprised that some people, there was a pushback or like, what is this? Because it's been around for so long.
Yeah. And I want to say part of this too is on the providers. Like, we need to make sure to let individuals know that they need their Tdap. We typically recommend it. It's in every pregnancy, by the way. So if you get it in one pregnancy, you're not like someone who is not getting pregnant, like your spouse, right? So he has to get his booster for it. But if you guys have a child again a year from now, he doesn't have to get another Tdap if he's updated on his booster. Yeah. But if you're pregnant again, just like you said, when you get that vaccine, you get these protective antibodies that cross the placenta and get to the baby because you have this newborn at home for months that can't get vaccinated.
Yeah.
And they showed great data that when we started increasing the amount of people receiving that vaccine at the 28-week mark or beyond in a pregnancy, the rate of neonatal pertussis went down substantially. And if you have a 1 or 2 month old who gets pertussis, like the whooping cough, this like nasty
I've seen some videos.
Cough.
It's terrible.
And those kids end up sometimes in the ICU.
Yeah.
It's not just like a common cold. Like they can get really sick. So it's protective for the baby. So I think we as providers have to do a good job at educating our patients. That's part of what I want to do with people that work with me too, is like, hey, don't forget when you're 28 weeks, you got to get that Tdap shot. And I love how you advocated for people being around your family.
Yeah.
Plus it educates them, right?
Exactly. It's an education. I think a lot of times it's been, years since they've had a kid, so they just might not remember. So it's just re-educating them.
Yeah, exactly. So I wanted to kind of phase into what you do for a job on day-to-day basis and working through the midst of COVID, right? Because everything was changing, and how you feel like you managed working and being pregnant at the same time from the standpoint of you just going through it, how you felt like job worked with you and how you felt like the appointments worked with you having a schedule that might have conflicted with being able to have follow-up appointments, and just how did you manage all that?
Yeah, so I was working remote because of COVID. My company was based out of California. And when I found out I was pregnant, my company actually came to me and wanted me to re-up my contract for a few more months. And they obviously didn't know I was pregnant at the time. And I was, nervous. And my husband was like, well, wait, are you going to do this? Are you sure you want to do this? It's the beginning of your pregnancy. You're not going to know how you feel. But I felt confident that I could juggle both. And in the beginning, in my first trimester, I was traveling quite a bit. And, maybe it's that ignorance is bliss or that I didn't know what to expect. But I'm now looking back, I'm so glad that I did, because then once you have the baby, your life completely changes and it's harder to travel and do things like that. But I remember being at a premiere. I worked for a streaming service, and I was at a premiere 10 weeks pregnant. And I remember by the end of the night, my feet were killing me. I was exhausted, and it was more than my normal levels of exhaustion. But then I think from there, the great thing with a lot of jobs being remote now is that I was able to still take all of my appointments. I was able to do things that I might not do back in the day when I was in an office that might have been much more challenging, because I didn't realize before I was pregnant how often, especially in that third trimester, you are at the doctor every single week.
Yeah,
so,
lots of visits. And when you mentioned you were 10 weeks along, I think people forget a lot of the physiologic changes occur very early, particularly for the lungs, right? Like you get short of breath a lot quicker.
I was winded. I was exhausted. And at that, in my first trimester, all I wanted was complex carbohydrates. And so just being able to fuel my body, but still being able to work was really, it was tough.
It's a challenge.
And when no one knows, it makes it even harder, because then at least, when you're keeping it a secret, it's just this whole other level.
Yeah.
It takes a toll on you mentally too.
Yeah. And so when you say keeping a secret, I feel like a lot of my friends who have been pregnant, they always have this number in their mind. Like when I get to this many weeks, I'm going to tell people, is that a fear for miscarriage?
Yeah, I think it's a fear for miscarriage. I think I think the blessing and the curse of the world we live in is you find out so early now.
Yeah.
So we found out when I was 6 weeks pregnant. I, peed on a stick. We were like, oh my goodness.
Yeah.
So I think we wanted to wait till that 8-week appointment when we could see a heartbeat and that it was viable. And from there, we did tell close friends and family, slowly but surely. And I think I got to a point where, if I was to have a miscarriage, those are the people that I would share it with anyway.
Yeah.
So I felt comfortable sharing that I was pregnant. But I think it's a scary thing. It makes it feel very real. And then, that doesn't go away your whole pregnancy. I remember I had a lot of anxiety actually towards the end of my pregnancy, because you're so close to meeting, this thing that you've been growing inside of you, and all you want is for it to be healthy.
Right.
And so the anticipation as we got closer to her due date, I was like, every night I'd be like, I just hope is everything okay in there? Because as much information as you're given and everything there's still some uncertainty.
Yeah. And so talking about the information, what are some things, having it be your first pregnancy, that you were like, I didn't know these things, or I didn't really know the places to go for them? What are some of the things that I guess you just not struggle with, but you were like, man, this is like a topic that I feel no one's addressing?
Yeah. I mean, I think, one, I was shocked at how few ultrasounds you get if you're a low risk pregnancy. I thought I would be getting ultrasounds all the time and I'd be able to see her. And to realize, for my pregnancy, I think I had an ultrasound transvaginally at 8 weeks when they,
to confirm the
pregnancy and the heartbeat. And then at 12 weeks, I believe they did the second one. But then it wasn't until 20 weeks for the anatomy scan. And then again at 32 weeks. And at 32, for the growth. And at 32 weeks, she was hiding, so I could barely see her.
Yeah.
They told me everything was good, but that was really surprising to me. I think all of the testing in the first trimester. I had no idea what I was getting into. And my husband and I are both Ashkenazi Jews. So we needed to do testing even prior to me getting pregnant to see what certain risk factors or, if we were both
carriers
for certain things. So,
that's such a good point. Like the carrier screening, I feel like it's not brought up to people regardless of background, right? But you guys are both at a higher risk of being carriers for these autosomal recessive disorders.
Yes.
So for those listening too, like if it's autosomal recessive, if Brittany and her partner both carried the same mutation or the same concerning item, then together they could have a 25% chance of having a child with the disease, a 50% chance of the child being a carrier like they are. And those are some big numbers. Everyone should be offered carrier screening.
Yes.
And then for those of Ashkenazi Jewish descent, their carrier screening should be more expanded.
Yes.
So it's not like you only get offered screening if you're of a certain background. It's just the amount of autosomal recessive disorders that they might check you for would increase.
Yeah.
So you guys did screening before you became pregnant?
Yes, we did screening before I became pregnant. But I also had friends who did carrier screenings when they were pregnant. And I think there needs to be a better job done of explaining that this, because you're a carrier for something, doesn't mean your child is going to have this. Because I had a friend who they called with her carrier screening and they said, okay, you're a carrier for these 4 things. And she started crying immediately because she just, it's scary to hear.
Yeah.
And I think there needs to be more done where where people know like, oh no, this just means you're a carrier. This does not mean your child is going to have this.
And this is where just part of my goal of doing everything I'm doing with any of this Dr. Lexi stuff is the gap between provider and patient, I think is getting bigger and bigger sometimes as we're continuing forward in healthcare. And I think it's sad. And the thing that you just kind of said too is, when the results come back, there's 2 things that probably I would assume happen when that happens. Number 1, it's not explained to them what test is being sent. Yes. And number 2, when they get the results, I wonder who tells them the results.
Exactly.
Like if it's a front office staff or someone they don't know, that's okay if, this is my opinion as a provider. If I say to you, Brittany, we're going to send a test called carrier screening. It will screen you for however many number we're going to test items to see if you're a carrier. If you come back positive for any of those, our staff is going to call you. And then we would test your husband. So not until both of you are tested do we truly have concern that you could pass something on to your baby. Then if you get a phone call later and someone says you're a carrier for 2 of these 500 or whatever, you're like, okay, now I know the next step is.
Yeah.
As
my
opposed
husband's going to get tested versus.
Right. And I think that we as providers, offices are busy, right? A lot of doctors' offices are owned by larger companies, corporations, and it's become like a business. And I know it is, I get that, but I feel like doctors do find it difficult, and providers in general, to spend as much time with their patients. And so someone assumes that someone else in the practice has explained a test to a patient before it's sent. And I feel like they just don't have the time to do it. So that's part of my goal. Like when Brittany and I worked together, it was, okay, when you go into this appointment, these are the things that you need to make sure have been done. If they're not, ask for them to be done.
Exactly. And I think that became glaringly apparent, especially during my ultrasounds. I remember my 20-week anatomy scan. I went in with the tech. We do the scan, and the tech can't provide you with any information. Right. And then the doctor came in and said, I still need to look over everything, but, from a quick glance, it looks good. But you'll get a detailed report.
But what are you going to do with that report?
Exactly. So then I get this document in my portal. I don't even get a phone call. I just get a document. And I have no idea what anything means. And so I remember sending it to you saying, hey, can we do a deep dive on this? Because someone saying everything looks good isn't really helpful, because I didn't even know what most of the information on the sheet meant. Yeah.
And that's where, so in a general world of like how medicine works in it right now, what would you do? Like, had we not worked together, what would you do?
phoned a friend.
Yeah. Got on the internet.
Consulted the internet and been frightened at what I saw. But I think, advocating for yourself, and whether that's hiring an advocate that knows the right questions to ask and can help you do a deep dive on the information. I am someone who is type A and a bit of a hypochondriac. And so to me, it gave me peace of mind to be able to talk through it with someone.
Yeah. And it's that part too. I think when you get a report, that there's a lot of medical terminology there, right? So there's no way that a patient is supposed to be able to interpret that at all. I mean, there's no way. That's just not what, even when I get a radiology report, like if I have an x-ray, I'm like, I'm going to have to call somebody.
Yeah.
That's not my field even. So I think that that's the biggest thing too, that even though we have low risk pregnancies, they're not without risk. And it still doesn't mean that you should be informed less or communicated with less by your providers. And hopefully being able to talk to someone like me can bridge that gap a little bit. So even if I'm not performing your ultrasound, we can still go through your ultrasound and I can answer any question on that list for sure. And then give you a plan for follow-up. Like, hey, notice here that they mentioned something about the umbilical cord. Are we going to follow up on that?
Yeah.
Is that something to be concerned
Or my
about?
short cervix.
Yeah.
Or we can keep monitoring this and see what happens.
Yeah. So just those little things. Because when you mentioned too, advocating for yourself, this is what gets me. I love when people self-advocate, but here's the question. How do I advocate for myself if I don't know what I'm doing? Right? Like if I don't know the questions to ask and no one's educating me in that little blank space there. Right?
Well, and that's why your process is so streamlined. I can't, say that enough, because you broke it down by not even just trimester, but also by appointment.
Yeah.
You knew, okay, at this appointment, XYZ is going to happen. These are the questions you should ask. This is what you should be prepared for. If they say this, talk to them about this. And I think that's what was so helpful, because it was a path for me throughout my pregnancy, because as much as I did advocate for myself, I didn't know what to advocate for and the questions I should be asking.
Right. And I think the unknown is very scary. So if it's basically like a map for your pregnancy, right? Like, here's what to expect at each of these appointments. And if that's not happening, it should be happening, right? The terms in pregnancy too, as we found, there's so many the abbreviations. And then the big thing too, before you went in for your ultrasounds, we actually would go through, here's what they're going to do.
Yeah.
So you're not even going to be surprised about what they're doing, right? They should explain it to you clearly. But in case you're missing any of that explanation that you're receiving on that end, you at least have the ability to know in your mind what's going on.
Yeah.
Which is I think helpful, right?
Incredibly.
And then the other thing I wanted to bring up is this Down syndrome screening, because I think that it's a test that's very complex.
Yes.
And every patient is meant to be offered screening for Down syndrome. Every patient should be counseled before the blood is sent so that you know what it's screening you for, and then results should be reviewed with you. Do you feel like that process was pretty seamless at your OB office, or how was your experience with that? Everybody seems to have a different experience with it.
Yeah, I think it was, it was one of my first appointments. They talked about that and what my options were and asked if I wanted to. And, we of course wanted to do that. We think more information is, power. So we were on board, and then they did the blood draw. But I remember because it came back that we were negative, and then we were also finding out the sex of the baby that way. It was just, again, another email in my portal. So I don't think there was a ton of education around it.
Right.
It was just a simple, do you want to have this blood test? And we did.
Wow. And, here's the other thing too, and I don't have the website on me, but I'll remind myself to include it in the link below when I post this. But there was a recent article too, because these tests sometimes will come back abnormal, but it could be something going on with the mom.
Yeah.
Even like cancer, right? Like big stuff. So when the results come back abnormal, I feel like if you don't tell someone when you send it that if they come back abnormal, it doesn't mean that your child necessarily has Down syndrome. It could mean something else. It could be a false positive.
Yeah.
There's been a lot in the news lately about, these tests during pregnancy are scaring people, right? And I think part of it is we're not educating people ahead of time.
Yeah.
So I mentioned earlier the ACOG, ACOG website, where they have frequently asked questions for patients. They just in the last few weeks, they put up a video for patients to watch that explains cell-free DNA screening, which is the test that everyone's basically offered now for Down syndrome screening. And it's it's a good video. It's
Yeah.
pretty descriptive. And practices are supposed to either explain it to patients, or a lot of them have little videos that they are supposed to kind of have people watch. I think we're, as a society, as practices, as practitioners, as providers, everyone's so busy that there's just not the time. But then when the results come back, it just, if you took that 5 minutes at the beginning,
Exactly,
you're just going to have a better experience, a better understanding, and not feel as scared.
Yeah. Well, after I gave birth, they also took my blood. And I remember probably a few weeks postpartum, I received a letter in my portal, and it had my blood test results, and my white blood cell count was off the chart. And I didn't realize that that's natural after birth. No one had explained that to me. And it was so high that it was like,
flagged.
It was flagged.
Right. Yeah.
And so I'm freaking out like it's something else wrong with me. And until I, again, had to advocate for myself and call in and ask to speak to the doctor, and who assured me that it was completely normal. But if I wasn't, it's alarming to see, and you wonder, oh gosh, is something else going on? So I think it's just taking that few minutes to explain things.
For sure. And the big thing when you mentioned to labs, everyone should know this as well, but labs, there's not, and I've said this on anywhere I can say it. If I wanted to make a lot of money, do you know what I would do? I would create the ability for labs to have normal pregnancy values, so that when you receive blood, you need to know whether the individual is pregnant or not.
Yeah.
And then the results would come back flagged for pregnancy as opposed to flagged for people in general, right? Because so many things in the body change.
Yeah.
Like the creatinine changes. It's just so many people, the thyroid labs change. So people will sometimes, friends of mine, oh my gosh, I have these labs. Can we just talk about them or something? And it's like, oh, is it these numbers, and are they up or down? They're like, yep. I'm like, that is normal for pregnancy. And if no one reviews that with you, holy cow, right? Because the portal is awesome because you can get results quickly, but you'll get them probably before your provider sees them.
Yes.
And not knowing some of those things can cause a lot of fear, a lot of anxiety. And that's part of my journey too with people, is to try to help them understand ahead of time. If you get labs done, there's going to be some that are going to be a little bit different because you're pregnant, but they might be flagged because no lab uses pregnancy values, right? If anyone ever listens to this and has the ability to do that, please call me and we'll figure out a way to strategize that. More for it just to happen for people, right? Like what if a hospital did that too? That'd be great.
Yeah.
Because the hospitals don't do that either. And then you get people consulting on pregnant individuals and they start to rate the labs are abnormal. And it's like, thank you for consulting Mr. Person from gastroenterology.
Yeah.
But that's normal for pregnancy, right? So it's kind of interesting. Well, I thank you for all your time today. I want to kind of ask a little quickly, do you have any myths or anything that you can think of that you heard while you were pregnant that you would love to be like, number one, is this true? Or number two, I wish I would have known it wasn't true?
Gosh. So, well, I think right in the beginning when before we knew the sex of the baby, I wasn't incredibly sick.
Yeah.
I was a little nauseous. So people were convinced I was having a boy. They're like, oh, you're not sick? Oh, it's a boy. It's a girl.
It's a girl.
So I think that was one from the beginning that I thought was funny. In the beginning of my pregnancy, I did read Emily Oster's book. I did the audiobook, and I think that was really helpful because she also comes from a very data-driven place. So I think she debunked a lot of myths or things that I, had percolating in my mind or was worried about.
Yeah. That's always good. I love that. Well, if anybody has any questions about myths too, I'm always here to attempt to find answers.
I think they're so funny.
There's so many. There's so many. Well, today we were doing kind of our basic that we try to do. We're trying to expand our knowledge. And so we had so many good topics to talk about today. The low risk, quote unquote, again, pregnancy is something I just find, again, an excellent term to use because it helps us understand that we don't have any high risk issues that we're dealing with, but also the fact that no pregnancy is without risk.
Correct.
And to know your body and be able to advocate and talk to your provider as best you can. Developing some skills. We did an excellent job at that today, talking about different sheets we can use. Again, the drlexihill.com/advocate is a great place to start for getting those questions and developing those skills and being able to speak up and talk to your provider anytime you want because it's your body, your pregnancy, which is fantastic. And then the impact we're having, I am so, so hopeful that getting information out there for people to learn a little bit more about you can take charge for your pregnancy. You can reach out to me and book a consult. You can go online to my website. You can go to the YouTube and learn more. You can buy modules to help you understand high-risk issues. You can, there's so many things to do to have this impact. And so I always try to also kind of come full circle and ask any guest for impact for you. I always say to people, this is something that has an effect, a strong effect on something or someone. And for you, if you're talking to anybody out there listening who is going through a first pregnancy or planning on a first pregnancy, what could you tell them about the impact you want to have on them or that they can have on their pregnancy or others? Anything like that?
Yeah, I think advocating for yourself, number one, and that is finding someone like Lexi and going online, because I think there is so much information out there. But again, is it the right information? Is it factual information? So looking at her modules, looking at her checklist and things to do before you go to the doctor and what questions to ask. That had a huge impact on my pregnancy and made me feel at ease. I can say I was lucky to have an uneventful, quote unquote, pregnancy, but I also feel like a lot of my fears were put at ease because of the work that I did with Lexi. And then the other thing I would say is so many people talk about the pregnancy, but they don't talk about the fourth trimester, which you mentioned. And I think all of a sudden you have this baby and you have to figure it out. Again, you think doctors' offices are busy? Hospitals are incredibly busy. I think I was in the hospital for 24 hours, like on the T. Then you go home with this baby and you have to figure things out on your own. And, whether that's working with a lactation specialist, whether that's working with a postpartum doula, I think arming yourself and setting yourself up for success once you give birth is so important. And a lot of people don't take the time while you're pregnant to think about your plan for the fourth trimester and how you're going to set yourself up for success, because it's an incredibly overwhelming time.
Yeah. Very well said.
Thank you.
Thank you again for coming.
Of course.
And chatting with me and
Anytime.
with everyone listening. And, coming soon and everything on the website. So many things that are there. Yeah. But places to go right now too, drlexihill.com/pregnancy- just a little hyphen, advocacy. And so I put it on there that's where you can get the one-on-one consults. That's where you can decide you want just one visit, right? Just whatever. And you don't have to go through your insurance. You don't need a referral. Like it's kind of nice. You can schedule it online. Nights or weekends are usually involved too, which is nice. So it's not typical doctor hours. It's going to be via camera, so you can live in whatever state you live in, and I can live where I live, and we can figure out a time to visit. And in no way, shape, or form is anything I'm doing meant to be replacing your OB provider, right? It's just an extra level of comfort.
And a lot of times questions come up. You leave the office and you go, I meant to ask that. And then it's really hard to get in touch with your doctor.
Yeah.
And so having you there is a resource. And I think just having that person that you can talk to whenever about your pregnancy journey is so helpful. I know I've said that word 100 times, but it's the best word to describe
so true.
Your services.
And I love that you mentioned too about reaching people, because that's part of the advocacy training that I do, or just kind of work that I do, is find out all the phone numbers.
Yes.
And put them in your phone. It sounds so simple, but you got to know if it's 2 a.m. and you think you're going into labor, is it going to be your doctor that delivers you or someone else? Just so you know,
have
right?
to know.
We don't like surprises unless it's our birthday. That's what I say. That's what I say.
I like that.
Yeah, right? So again, thank you so, so much, Brittany. I cannot express how much I am just so excited to have had you today.
Thank you. You're so welcome. It was wonderful to be here.
Thank you. Well, thank you all for watching, and thank you for listening. Again, I'm Dr. Lexi, wishing you all a happy and healthy pregnancy.